So welcome. Thanks for taking the time to attend this webinar today. This is the second in a series. The first one was Chrissy Bafanis, who is our occupational therapist. This is the second, and we are happy to welcome Charlie Page, who is the Director of Pharmacy for Gear Village Senior Community. The third one is going to be Mike Mangini, who many of you have heard before, and he is going to be at the end of November on the 18th. Charlie's been with Gear for quite some time. I can have him do a little bit more detailed introduction, but what he does for our campus is he serves all of our residents and as well as the staff and many of our family members. And he and his group, his team, actually provide a lot of guidance, suggestions, obviously prescriptions. That's the typical that you know of, but Charlie has a lot more knowledge beyond just that. So I'm going to let him get started and do his presentation. Thanks for joining us, Charlie.
Thank you very much for having me, Stacy. I appreciate it. I appreciate the opportunity. I've done some of these talks in the past with the Lodge, but it has been a while. I like this idea of this wellness series. This is it's a little bit different type of presentation than I've done before. Before I was more plugging our pharmacy and what we do, but this time it's going to be more about a specific idea of how to get the greatest benefit when a medication is prescribed. And I am going to throw a little plug in for the pharmacy also while I'm at it, just so you know. All right, so let's just get started here. So our pharmacy, Gear Pharmacy, we're operated, we are under the Gear umbrella of entities. So we're part of the Gear campus, we're part of the nonprofit. We are owned by the Gear Corporation, it's not owned by me. It's available to, as Stacy was saying, all of the Gear residents on our campus, and that includes all the buildings, including Beckley House, which is an apartment building on our campus, all the patients, and then all of the staff living or working on our campus. And as shown here, we are located right on the first floor, very convenient. Of course, it was convenient when you were able to come into the nursing home, but nowadays you can't. But we do offer friendly curbside service when you come to pick up your prescription here at the nursing home. So who are we here at Gear Pharmacy? I'm Charlie Page, I'm the Director of Pharmacy. I have been here for, actually, it's been almost 19 years now. I graduated with my doctorate from Creighton University in Omaha, Nebraska in 2001, and I got my Bachelor of Science from Pharmacy at UConn in '93. Kim Jackman is our part-time staff pharmacist. She graduated from UConn back in 2018. She's been here for about 2.5 years now. And you might all know Jessica Stedman. She's a local woman here. She's been here for 13 years at the Gear Pharmacy as our technician. And so I like our team here. We get along very well, and we like to serve our campus here. What do we offer here at Gear Pharmacy? Well, we are very unique here at Gear Pharmacy because we are actually located in the nursing home on a campus like this. Most long-term care campuses and facilities get their prescriptions delivered to them from a big warehouse, centralized pharmacy that has couriers that deliver, several times a day to all over the state and even beyond our state, even to the whole Northeast. So there's a long delay time in between when they get an order and when it actually gets to the residents. Here we are right downstairs from the residents. We can run things up right when they're needed, and we have relationships with the nurses, the prescribers, all different departments here in our campus. We have expertise in geriatric medication management and familiarity with all local physicians. Since I've been here so long, I've seen a lot of doctors come and go in this community. It's actually kind of alarming how things have changed so much, but we still are here. We're still reaching out and trying to make those professional relationships and maintain them to give our patients the best outcomes. We do have extensive knowledge and experience with Medicare Part D, which is the drug benefit of the Medicare system, as well as any other commercial insurance plans. We basically take just about every insurance plan here at Gear Pharmacy, despite our small size. And so again, we have personal service with staff who not only we know our residents here and they're familiar with us, but their medication regimens intimately, not just the regimens, but how they got that way. Why did they change? We have a much more in-depth vantage point here than many other pharmacists would be able to have, whether they're in hospital or in retail, just because of our location and the setup here. Like I said, it's quite unique. The pharmacy itself was remodeled. I'm going to back up here. We were remodeled back in 2013. Before that, it was really just a little hole in the wall. And then when Kevin O'Connell came on here as our CEO, he realized what I was asking for quite a while, that we really need to remodel. And here's that little picture in the corner there you see. It's pretty nice. We have all the drugs are on the back wall. There's no bays to walk down, nobody to run into. There's an island there in the middle. It creates a great workflow. And we have the technology that we need. We're not high tech, but we have all the technology we need to provide a really good service here. I forgot also to mention that we do serve as I serve as a preceptor for University of St. Joseph School of Pharmacy students who are going for their pharmacy doctorate. They come here throughout the year, usually 1 day a week for about 5 weeks. And I teach them everything I know, and they appreciate the different atmosphere that we have here. Okay, service. Okay, so let's say, okay, we're done with the introduction now. So let's get to what this is really all about, and that is getting the greatest benefit from your medication. So you go to the doctor, either for, maybe you went for an annual checkup, or you had some kind of actual complaint, and that's why you went there. First and foremost, medication related, I want everyone to make sure that they know, that the doctor knows any allergies or intolerances that you may have. If they forgot to ask, then they're not checking. It's just a very important thing to make sure that everybody knows. The doctor knows, the pharmacist knows, your caregivers knows what allergies and even just intolerances. There's a true allergy where you take something and something bad happens, like a rash or a violent reaction of some kind. And then there's just intolerances where, you know, some tablet might make you very nauseous, much more nauseous than usual, or vomiting, or some kind of a reaction that just, it's not an allergy, but it's just something that happens that makes it that you do not want that medication again. So make sure that knowledge is all up front. Okay, so let's say that all happens, and now the medication, the doctor prescribes you a medication. There it is. How are you going to get the greatest benefit from it? Well, the first thing you want to do is just learn about it. So you ask your doctor or APRN, whoever prescribed this medication for you, what the medication is, why they prescribed it, how it works, you know, not just what it's for, but how it does what it does, when and how to take it, and also how expensive it might be. And that's going to be something we're going to talk about later on. The expense of the medication can be a big factor in how things work out. And then after that conversation that you have with your doctor or APRN, when you're comfortable with what they told you, it's time to fill the prescription. So where do you go to fill it? Well, you're going to go to a pharmacy, but what kind of pharmacy you go to is going to have a big difference in the way things go. Why is that? Well, when you go to a local pharmacy versus, you know, a mail order pharmacy, you're going to get a lot more one-to-one service. You're going to get to know the person that's behind the counter there. So think about who's going to provide you the best service, who's going to take the time to talk to you about that prescription, maybe the first time you get it or the 12th time you get it. Who's going to take that time to sit with you or talk with you on the phone and know you and know your history? So those are questions to think about when you choose a pharmacy. Chains and in big box pharmacy, when you go in, what is it like when you go in there? Do you have a good feeling? Is it nice and quiet? Do you get the attention that you want, or do you feel that stress from the employees behind the counter there? Is that stress kind of, you know, are you feeling that also? Is the pace frantic in there? I know that sometimes they are, because I have worked in them. So has Kim, our other pharmacist, and most pharmacists out there have gone through those types of pharmacies, and we just know what it's like. I'm not saying that they're all bad, but what I am saying is you do kind of have to pick up on what it's like, and is that the environment that you feel is best for your medications to go through? Is that the best team for you to get what you feel you need is best for yourself? Now take that and compare that to an independent pharmacy. As you well know, in this area, independent pharmacies are becoming a very rare breed. We had a very sad recent phenomena where Salisbury Pharmacy was bought out and closed, and all their prescription records went over to CVS in Millerton, New York. We also used to have a small pharmacy in here in Canaan Apothecary, again, closed due to different factors, things like low reimbursement levels. That's one of the biggest things. And then just practices that the insurance companies take to just claw back money that really is meant for the pharmacy, but they find ways to just take money away from pharmacies. And unfortunately, that's just the way things have been going. Gear Pharmacy is still here. There's a few reasons for that. One is that we are a nonprofit. Nobody here is getting rich. The profits from the pharmacy go straight back into this campus here and go towards improvements and better care for our residents. And so my recommendation here is to say, if you can possibly find an independent type of pharmacy to get your prescription filled at, I think you're setting yourself up for success. So just think of an example. When you go to a hardware store to buy a tool, that's a much different, your local hardware store is a whole lot different than going to, say, Home Depot or ordering something on Amazon. How much extra information is the employee at Home Depot going to give you on that tool, as opposed if you went to Lindell's in town, you know who they are, they know who you are, you have a relationship, you talk. Very similar thing with pharmacy. Also, with Amazon, where are those profits going? Well, they're going to help Jeff Bezos go up to space. Here at Gear Pharmacy, I'm not going to space. I like to go hiking and paddling, things like that in local areas. So just think about who you're dealing with. All right, so let's talk about some kinds of hurdles that can happen before you actually get that medication in your hands and at home and you're ready to take it. You're at the pharmacy and the doctor sends the prescription there and you go to pick it up, but it's not ready yet. Well, why wasn't it ready? Well, your insurance plan very often can reject the medication that was prescribed because it's not on what's called their formulary. And a formulary is a list of covered medications that the insurance company pays for. And if it's not on that list, or sometimes they have different tiers on that list, like a tier 1 is covered, no problem. Tier 2 is, well, we need some more information first. And tier 3 is, no, we're not going to cover this until the doctor jumps through a whole bunch of hoops. And once he goes through the hoops, maybe we'll cover it. So they have these lists. And when they say, no, it's not on our list, we don't want to pay for it, then it gets rejected at the pharmacist level and it says prior authorization is required. And that's when the pharmacist has to call the doctor back and say, all right, you prescribed this, but their insurance plan doesn't pay for it. So you're going to have to go online and go and answer all these questions for the insurance company before they're going to pay for it. And so you have to sit and wait. Maybe you have to come back later to the pharmacy and hopefully it's ready. Maybe the insurance company says something like, well, you can't have that medication because it's too expensive, but you can try one of these less expensive types, what's called step therapy. So try something that's been around a lot longer and is available as a generic. You try that first. Then if that doesn't work, then you can have the more expensive one. Another thing is that if you get a pain relief medication, an opioid, a narcotic pain reliever like hydrocodone or oxycodone, most insurances will say you can't have a 30-day supply or a 60-day supply right off the bat. They will limit you to 7 days on the initial fill. And that has a lot to do with the opioid epidemic. And they don't want to be a part of that. So they limit you to that first 7 days. And if you can tolerate it after that, then you can get more after that. So when something like this happens, especially with a Medicare Part D plan, you actually have rights. So if you have Medicare Part D and the medication was prescribed and it wasn't covered, but you really feel that you need that now, as opposed to waiting 3 or 5 days for the doctor to do the work that they have to do, you can actually call a phone number, tell them your complaint, and they can do an investigation for you and possibly help you get that medication covered faster. I don't have that phone number for you right now, but it's available online on the Medicare website. And if that happened to you, I welcome you to give that a shot. So if it's not covered, of course, everybody has the right to just say, okay, well, how much does it cost otherwise? So you can ask, what's the cash price of that medication? And oftentimes, if it wasn't covered by the insurance, then it's probably going to be something very expensive, and you're going to be, you're going to be, oh my gosh, that's way too much money to spend. And you're going to think, oh my gosh, now what am I going to do? Well, there are some other things that can be done besides your insurance company. There are also what's called a patient assistance program. There are these coupons that the manufacturers create when the prescription is prescribed, and it allows you to get a discount straight from the manufacturer. So instead of paying $300 to $500 for that 30-day supply, you might just be paying like $40 or $50. So it can be very helpful. You got to watch out, because if you have a Medicare Part D plan or any other government plan, sometimes those discount cards don't work, but they are worth asking about and looking into. And very often your doctor can give you that information right when they prescribe it. In fact, that information can get sent electronically right over to the pharmacy, or you can go online, whatever the drug's name is, like something like Januvia, as a diabetic medication, or Lantus insulin. You can go on their website and you can find it, and you can print that out and bring that to the pharmacy also. So like I was saying, cost can be a very big factor in the outcome of your medication regimen. All right, so let's talk a little bit more about the insurance. So when the prescription goes through all those processes that I just mentioned, and then it finally gets a verdict, and they say, okay, we're going to cover this. It's covered. Then you get all excited. Okay, this is great. Now I can go pick it up. Well, you got to pick it up. What is your copay? What is your portion of that price going to be? Sometimes, even when it's covered, that copay can be very high, either because that's just what the straight copay is because it's so expensive, or if you have a Medicare Part D plan, your prices, and you may have seen this, your prices can vary. They're all over the place. And I know that because I see them right on the receipt, but I also know why it's happening. And the patients that this happens to, they call me up and say, you charged me this much this time, you charged me this much this time, and this much this time, and on the fourth time it was different again. What's going on with you? And I have to explain to them, well, here's what happens with your Medicare Part D plan. You are paying a monthly premium just to have the Medicare Part D plan, just to have the insurance. So you're paying $17 a month, $30 a month, depends on the plan that you chose. Then just to have that insurance, okay, then you have to pay on your first prescription. It usually goes towards a deductible. Some plans don't have a deductible. Most of those ones are more expensive to purchase, but most of them have a deductible. So you have to meet that deductible first. So you're paying pretty much full price on that prescription until you meet the deductible. It's just like your car insurance or your homeowner's insurance. Then after you meet the deductible, you go towards this initial benefit. And that's where you're starting to pay, a more reasonable copay for the medication. But with Medicare Part D, that part of the benefit doesn't last forever. What you go into what's called the coverage gap. The old name for that was the donut hole. It still exists. Recent legislation has kind of tempered it a little bit, so you're not paying the full price of that medication during the coverage gap, but it's still there. You're going to pay more during that time period, which is why these prices vary so much from the first time to the second time to the third time. And then even the coverage gap has a threshold over which your prices then go way back down to what's called catastrophic coverage. So after the coverage gap, where you were paying maybe $100 for that medication, then they say, okay, well, you've put in your time, now you're good. Now your copay is going to be $10 or $25 or something much more reasonable. A very good example of this would be a medication called Eliquis or Xarelto. They're in the same medication class. They're fairly recently developed drugs for anticoagulation. So if you had what's called atrial fibrillation, which is a heart arrhythmia, or if you had a recent blood clot, they'll put you on one of these medications. There are substitutes for Coumadin. Coumadin was great, except that you require a lot of blood tests for that. With these two medications, you don't. So they're newer than Coumadin. They're not, the results of them aren't necessarily better, but they're a lot less testing, so a lot less labor involved. and they're just easier to take, but they're new and they're expensive. So you get prescribed this because you're newly diagnosed with atrial fibrillation, because you went to the hospital and you came back and you have this new prescription, and you have a new prescription plan. The first time you get it, you have to meet that deductible first. So it's going to be pretty expensive. The second time you go to get it, it might be less expensive, but it's still going to be a decent copay. Maybe the fourth or fifth time, well, now you're into that coverage gap. So it's going to be really expensive again. And then after a couple of refills of that, maybe by September, October, you're down into that catastrophic coverage where your copay goes way down again. The reason I'm mentioning all of this is because some of these unexpected price changes can have an effect on people's ability to pay for them. And the ability to pay for the medication can have a big impact on the outcome. And that's what we're talking about here. That's our main topic of conversation here. So that's why I'm talking about this. All right. So let's say we've gone through all these processes and you are taking the medication. So how are you taking it? First of all, you want to take it as prescribed. Follow the doctor's orders. And also, if the pharmacist gave you a little bit of a consultation when you picked it up, follow what the pharmacist said. Let's ask these questions. Is this medication supposed to be taken routinely, like once a day or twice a day? Or is it something that's supposed to be taken just as needed? I have seen patients take something that was supposed to be as needed routinely, or they were supposed to be taking it as routinely, but they only take it as needed. It's strange, but people do. It's strange to me, but people do those kinds of things. Oh, I don't take my blood pressure medication every day because I don't feel like I have high blood pressure every day. I just take it when I feel like I do. Or yeah, this pain medication, most people only supposed to take it when I have pain, but I just take it around the clock just to keep my pain from happening. Those are both inappropriate and just reasons why you could run into problems if you're not taking it properly. Take the right dose. If the doctor said to take one, the pharmacist told you to take one, then don't take two just because you feel it's going to work better. Always ask, get permission to do that first, because there's a reason why that dose was prescribed for you. The time of day, ask the doctor or pharmacist, what's the best time of day to take this and why? And then there's ancillary instructions such as take on an empty stomach, take it with food, take it in the evening. All those are going to have an impact on how your medication is working for you. And then you should also know we've all heard about side effects. Well, there are some side effects which are pretty common, and so they could be expected. Doesn't mean you're necessarily going to have it, but they're going to be more common. So know what to expect. And also, if your doctor said that while you're taking this, we're going to need to monitor some things. So please come back for blood work. Whether it could be a drug level that needs to be monitored, or maybe they need to monitor your clotting level. Or there's all kinds of different things, or your electrolytes, lots of different things why you might need lab work while you're taking a medication. Continue to get this medication refilled unless otherwise instructed. If the doctor gave you a 30-day supply and you're starting to feel better, maybe you think, well, this is good, it worked, now I'm off the hook. But the whole point of it was to get you better, and now you need to continue to take to stay better. And while we're talking about these refills, you do have a choice there also. You can go to your local pharmacy and get it refilled every 30 or maybe 90 days. The price might be a little bit more than getting it through mail order, but the mail order, let's talk again about service. I hear complaints from people all the time that use a mail order service for the medications, and it gets lost in the mail, or it's late and they run out. And what happens when they run out? Well, they can try calling and stay on hold and through a call tree in the mail order place, but it's easier to just call Charlie at Gear Pharmacy and say, hey, can you help me here? And the doctor will call in a 10-day supply or something, and we give it to him. So it's just another reason why local pharmacies are great to support. And so we have these considerations that we've talked about. We have the price of the medication. We have the service quality of the pharmacy. Another reason to support a local pharmacy is just that sense of community. And again, keeping your dollars in that local area as opposed to sending your dollars to who knows where, somewhere in a big city, somewhere across the country. Why not just think globally and act locally? And also, does the pharmacy you're using provide delivery to you? That could be another big factor in getting your medication and taking it as prescribed. Okay, so we talked a little bit about compliance, taking the medication as it was prescribed. Before we go too much further, I wanted to mention those written materials that you get when you get a medication prescribed, and it's usually a few pages long and it's really small print. I like to think of that as kind of like your backup. I really wish that patients or customers would ask the doctor and have a conversation with the pharmacist and get those take-home points. What are the most likely things that could happen when I take this? What are the most important bullet points to know about for me to take this properly, as opposed to just relying on that small print guide that has every possible thing that could happen wrong imaginable on there? Because as you probably expect, the next thing I was going to say is that a lot of people look at that and they say, oh, I have that too. I have that. I don't want to take this medication anymore. There's too many problems with it. All you have to do is watch one of those commercials on TV that show you this beautiful couple walking around in a flower field, and then they tell you all the side effects of the medication. It's like, wow, I don't think I want to take that. Same kind of idea. All those side effects, by law, they have to mention them, but it doesn't mean that they're that likely. So it's a risk versus benefit thing, both when the doctor prescribes it to you and just you yourself, the way you think about it. So I wanted to bring up a document here. And here at Gear Pharmacy, a lot of times we try to help people that get discharged from here at Gear Nursing and they're going back home. They went to the hospital, then they came here for some rehab. And when they go home, I want them to be set up for success. So sometimes we send them with a box of medications to go home with. And even sometimes we continue to fill their medication boxes for them for several months afterwards, just to help them, because some of these medication regimens are so difficult. But I also make a nice organized color-coded guide that they can use for themselves at home, and also to bring to them to their medical appointments, or if for some reason they get hospitalized again, the hospital personnel can look at that guide and say, all right, well, this is nicely organized. Now we have a really good picture of where this patient was medicinally before they got here. So I want to show you that. And so this is the medication guide. So this is just a sample here. First of all, we have just some demographic information on here, and when it was prepared, and the date that was last filled, and the phone number and any other phone numbers on there. And then of course there's this little blurb here that says, please bring this list to any doctor's appointment, and please update the pharmacy with any changes that happen, because I can go right into my computer and make those changes. So we're all on the same page. It's almost like having your own little electronic medical record without actually being truly electronic. Electronic medical records are great, but I have to tell you, with a lot of experience in that area, it's not nearly where it should be for the best outcomes. Not enough people have access to it, and there's just still too many barriers to it to working properly. So in the meantime, why can't we make our own little system like this, where the patient, the caregiver, the pharmacist, and the doctor, and anybody else can be on this same page, and any changes that happen can get updated onto this document, so that once again, everybody knows when a change happened, why it happened, and so nobody gets misinformation, because misinformation is really one of the biggest causes of medication misadventures. I could give you lots of examples, but I will give you one quick example. My mother, who just passed away this past spring, as a pharmacist, I was kind of intimately involved in her medication regimen, along with my oldest brother, who was her caregiver at that time for a couple of months, who was also a pharmacist. And we had what's called a Google document. It was a shared document that we could both go to online, and we were looking at it, and it was very much like this. And it had, all of her new medications. She wasn't on a lot of medications, but right in those past few months, she was, because she did have newly diagnosed atrial fibrillation, and she had ulcers, and she had a new cancer diagnosis. And so there's all these medications, and it really was an eye-opening experience for me to just see how much influence we can have on this regimen just by a simple document that we keep in constant communication with. My brother could go in there and change something, and I can go look at it 1 second later and see the change that he made. And so I want to bring that kind of low tech but highly effective communication and use that here for my patients, because I just believe in how effective it is into creating good communication between everybody. All right, so and not only is the medication the routine here, but as you see below, you see some of the as needed medications that are on there also. And then any other notes, the Eliquis medication was stopped, maybe because the patient had an adverse reaction to it or it caused too much bleeding, so it was stopped. So any little bit of information that could help somebody that's caring for you in the future can go on there, and you can bring that around with you. So it's just a little project that we've been working here at Gear Pharmacy, and we feel that it's beneficial to people. So there's that list that I talked about, and you use that as a guide, and we update it when any changes happen, and you bring it to wherever you go. There's also the medication boxes that I mentioned that either you can fill it yourself if you're capable of that, or maybe a family member can do it for you, or maybe you have a home care nurse that comes to your house and they can do it for you, or maybe the home care nurses are just spread too thin because of labor shortages and they can't do it. So maybe you ask the pharmacist to do it. And that's one of the things that we're doing here. I have another little image here I'd like to show you. This is a 4-time-a-day medication box. And we're going through quite a few of these here at Gear Pharmacy, where, a complicated medication regimen where you take something in the morning, you take something at noon, something in the evening, and then again at bedtime. And there's just a lot of medications. Each one of those compartments, it can be overwhelming for anybody to deal with. And so we're offering that to our patients here, and we're really finding that it's helping people out. I think people are very appreciative of it. I even know that Dr. Kurish down the road in Sharon was very happy to hear that we were doing this as a value-added service to our patients here, just because he knows how important medications are and how risky things can be when they're not taken properly. So, and then there's also, if you're higher tech, if you're tech savvy, there are also phone apps that you can get for your smartphone that can give you a reminder of when to take the medication, or there might be, an alarm that goes off. It might not even be on a phone. There's just a separate little thing that you can have that you can set as a timer that just tells you, okay, it's time to take your medication. And those can be other things that can be helpful to you. All right, so we did talk a little bit about side effects. So because side effects can be scary, and it's a common word that you think about with a medication, let's get into a little bit more in depth and think about what do we understand about what side effects are? Well, most of them are transitory, meaning they just last a very short period of time, such as a few days. And most often you're going to see these very common side effects being nausea or vomiting or a headache or an upset stomach. I can invite you into the Gear Pharmacy and just show you, we can take off the package insert on any single medication, and the top things are going to be nausea, vomiting, headache and things like that. Almost any medication can cause that. But it's because your body is getting used to it. It's a new compound that you're taking, and your body has to adjust to it a little bit. And so it's nothing to be too afraid of. A little bit of nausea, hopefully not vomiting, but if it happens, give it a little slack, let it settle in for a little bit, even the headache, and after a few days, hopefully it goes away. Having said that, you do know when you need to talk to your doctor or pharmacist about a side effect, such as one that was not expected, something that wasn't on that list that you brought home, or the doctor or pharmacist did not tell you about, because not only could it be the medication that did that, or it could be some other problem that came up in the meantime that was not the medication's fault. Also, a side effect that was not expected, but it's severe, such as orthostatic. You probably never heard of this term before, but orthostatic hypertension is when you get low blood pressure when you take a blood pressure medication. It gets a little bit too low, so that when you get up from a sitting position or even a lying down position, you get that blood rush. All the blood is rushing out of your head down into your body, and you start to feel faint, and you could fall. That is a side effect of a good amount of medications But not only do you get that unpleasant feeling, it could make you fall. And nobody wants that. So that's something very important to keep an eye on. It's something that you should be told about this potential side effect, and you should know that it could happen, so that you, instead of getting straight up and walking away, you sit up first, and then you get up slowly, you see how your head feels, and then you can start walking once you start feeling better. Very important. So what are some things that can be done to avert these side effects? Well, just because a doctor gave you that medication at a certain dosage, maybe it's available at a lower dosage, and maybe that dosage was the right one for you. So it's something to ask your doctor about. You might just, instead of just saying, I don't like this medication, it makes me feel awful, or it gave me this terrible side effect, look into that possibility of just maybe taking a different dose to see if it's more tolerable to you, so that you can take it properly. And then there's other things that you can do to avert a bad side effect, mitigating strategies. A little story here. A few years ago in the summertime, I had a tick bite, and I had to take some doxycycline. It's an antibiotic that will get rid of the Lyme disease. And so, again, it was summertime, so I had to take this medication. And of course, in the nice weather, a lot of times you have barbecue. And we had, it was in the evening at home, and we had these great hamburgers that we made on the grill. Those big juicy hamburgers that you make on the grill that are much better than you get at the restaurant. You put all the toppings on it. Well, I did that. Now, the doxycycline, as a pharmacist, I know you're supposed to take it on an empty stomach, or if you don't, just a little bit of food, but not much. But I figured, well, I'm fine. I'm a pharmacist. I know what I'm doing here. I had 2 of those big hamburgers in the evening, pretty late. And then soon after, I said, oh, well, I got to take my doxycycline before I go to bed. So I took the doxycycline on top of those hamburgers. And soon after, I went to bed and think I'm going to wake up feeling just fine. Well, no, the doxycycline sat there right on top of that high-fat meal. And the reason why you don't take it like that is because it's very irritating to mucosa, meaning like your throat. So it sat right near the bottom of right near the top of my stomach, right near where your esophagus meets the stomach. And it felt like it was burning a hole there. And there was nothing I could do. I sat up in my bed. I took Tums. I took extra water, and it wasn't going away. And I don't want that to happen to anybody else. So I tell people, try to take that doxycycline on an empty stomach if you can. And again, so it's just one of those things. If you take that doxycycline and that happened to you, it's not necessarily just because doxycycline is bad, but there's lots of things that you can do to make it so that that unpleasant effect doesn't happen. So again, what can you do to be sure that this prescribed medication works as best as possible? We're kind of summarizing here a little bit. Take it as instructed by your doctor or pharmacist. Don't just wing it, and don't just feel, all right, well, I have it in my house now, so it's mine, so I'm going to do what I want with it. Medications are by prescription for a reason. They're not over the counter for a reason. So take it as instructed. And if it's not doing what it should do, or causing you problems, you need to talk to your doctor or pharmacist. And you need to know what kind of non-drug measures were prescribed to you and adhere to them. Things like a diet change. Let's say you're a newly diagnosed diabetic, and the doctor prescribes you a nice shiny new pill that you take home. All right, well, this is great. This is going to get rid of my diabetes. Not knowing or not remembering that you really have to change your diet. You need to lower the carbohydrates that you take, much less sugar. Or maybe you were prescribed a blood pressure medication, and you think, well, I have this shiny new blood pressure medication. I take it, I'm good. No, I don't have high blood pressure anymore. Well, you really still need to watch your sodium level and the way you eat. You need to exercise if you can, and there's a lot of other things that could exacerbate your condition. Much like with physical therapy, I go to physical therapy because I have some back pain and sciatica that happens, and I learn things to do that make it better. But I also have to learn things that not to do, certain body movements, or certain types of lifting that are going to get me right back to where I started from before, that I don't want to be. And there's also, of course, stress, physical, mental, emotional stress. If there's any way that we can mitigate the stress, that's going to have a big effect, not just on the way our body feels, but the way that medication works also. So, so the doctor is part of the equation, the pharmacist is part of the equation, but let's not forget that you yourself are part of the equation. So you do need to take that time to learn about the medication, how it works, why it was prescribed to you. Review that literature that came with it. Don't take everything verbatim, but it's still good to just become educated as best you can. I know medications are not everyone's thing. I know there's a lot of big words and terminology that you're not familiar with, but just take the time. A lot of this material that we send out to people is meant to be in layman's terms. But if it's not, and you feel that it's still a little over your head, just call a pharmacist, call the doctor and ask, I don't really know what this means. And just learn about the medication as best you can. And then even if your doctor or pharmacist doesn't give you the answer, or maybe they were not available at the time, there are a lot of good online sources for medication information, such as things like WebMD, or even if you go to the Walgreens or CVS chain website, you can type in your medication in those sites and you can bring up, those bullet points of things that you should know about your medication, and then everything else that you could possibly want to know about it. But your best source is really to ask your pharmacist or doctor whenever they're available. All right, I want to talk a little bit about belief in the medication. Everyone's heard about the placebo effect, and if you haven't, that's just the fact that if you take a medication, oftentimes just the fact that you're taking something is going to cause some kind of a change. And probably, I'm going to give you some notable examples. A big example would be an antidepressant medication. So let's say you knew you were depressed, you went to the doctor, you got diagnosed with depression, and they gave you an antidepressant medication. Well, if you look at the science behind the antidepressant medication, you would find that the placebo, which is really just a sugar pill, when they compared it to the antidepressant medication, worked actually quite well. The antidepressant worked better, but the placebo did a heck of a good job. And so that is a phenomenon, maybe because the medication is meant for your brain. Maybe it works, maybe the placebo effect is more pronounced in those cases, but the placebo effect happens it can happen across the board. If you haven't heard of Dr. Joe Dispenza, he's a brilliant man. He's a DO, Dr. of osteopathy, but he's written several books, and one of them is called You Are the Placebo. It's a fascinating book to me. As a pharmacist, it's something that I almost wanted to write a book about myself until I found that, but somebody already did it. He really studied how the brain works and how really to the exact scientific detail, what is happening inside the brain when you really believe something is happening. So if you take a medication and you believe, you don't just think, I think this is going to work for me. You already make the decision that it's going to work. Then that sets up a cascade of events inside your brain. Your brain chemistry actually changes. When you truly believe something externally is working, your brain actually instructs your body to start making proteins that it wouldn't have otherwise. And this isn't just an idea. He has the actual scientific evidence, as well as any scientist could spell out for you. I highly recommend reading his book. But he shows in brain scans, which shows you brain activity inside the brain, exactly what is happening. You see more activity happening on this side of the brain because somebody was told something is going to work. And another big prime example of this is back in wartime, I think it might have been World War II or maybe the Vietnam War. I can't remember which one it was. But morphine was used by field personnel that had to help people that were injured in the combat zone, and they would give them morphine to help with their pain. And of course, the morphine, once it gets injected to you, it works very well for the pain. Well, being wartime, they didn't have an endless supply of the morphine, so they ran out. And so they thought, well, the least we can do is just give them something to make them feel like they're getting something. So they used plain old saline injection. In almost all of the cases, more often than not, it worked just about as well as the morphine, which is pretty amazing when you think about it. Now, those are desperate times and desperate situations, but it illustrates the power of the brain when you believe something is working. Now, If you combine that belief with the actual scientific mechanism of how that medication is scientifically working, that to me is going to give you the very best results. Believe it, take it as prescribed, continue to take it with that belief, and you are setting yourself up for success. So let's go back again to why am I plugging Gear Pharmacy so much? What's different about us? Well, we, again, specialize in senior care pharmacy. We're kind of, like I said, in a unique vantage point. Here, we are located inside the nursing home. We have relationships with many different people across the board, different professions here. And we have just a much different way of looking at medications, how to prescribe it, and how we can help. One other thing is we must perform a comprehensive medication review for every single resident at Gear, both when they come in, when they go to the hospital and come back, or when they stay here. We have to do it once a month. And I want to show you really quickly, I know we're running out of time here, but I want to show you that list just so you can see the type of thing that we go through here every time somebody comes into our facility. We have to make sure that all medications have a diagnosis that match up with them, so that we make sure that you're not taking something that you don't need. We have to make sure that every as-needed medication has a reason for it. You take this as needed for what? I'm taking it as needed for pain. We have to know why you're taking it. If you're diabetic, we have to make sure that the diabetic medications didn't get forgotten when you came here, because I have seen that happen. We have to make sure that the medications are appropriate. We have to make sure they're, if there's any opportunities for less expensive medications, that we take advantage of that. You know, I don't want to get into detail onto every one of these, but there's a whole checklist of things that we go through. And I write notes to myself, and then I summarize my notes over here on the right. And we do what's called a calculation of the creatinine clearance. It's just big words for saying that we're checking your kidney function, because your kidneys are what clear the medication out of your body. And if your kidneys aren't working properly, we want to know. And so we can help to dose the medication exactly how it's supposed to be for you. So this is something that we do for every resident here in Gear Nursing, but we like to try to extend these kinds of benefits to people out in the community as well. And I just wanted to show you that, just because I really believe that's one of the reasons why we offer something so much different than other pharmacies in the area. So I'm sorry, Stacy, I know we're almost out, but I wanted to just quickly mention something called transitional care. It's something I'm very passionate about here. I mentioned my mother and her situation before. It just goes to show you, transitional care is when you go from a hospital to a nursing home, or from a hospital to home, or from a nursing home back to home. Any institution from one to the next is a transition. And in those transition is when things can go wrong. It's a gap in your care. It's a place where your information has to go from one place to another. And in that, what you think is seamless is not always seamless. Not everybody has access to all the information that is vital. So there's a lot of human error that can happen in there. And unfortunately, I'm just telling you the reality that the things can happen. And people like me, people like the next people after me, have to look for those kinds of errors and fix them when they happen, and also try to prevent them before they happen. If you or your loved one is going through a time of you're having a new medical diagnosis and you had to go to the hospital, or you had to go to the nursing home, or both, or you're going home, just know that in between those times are when things could possibly go wrong. And it's really nice to have somebody looking out for that for you. And that goes back again to those the medication sheets that I showed you. When people are on the same page and know what you're taking, how you're taking it, why something was changed, you get the most up-to-date information. Information is really key here. And I just wanted to stress that. It's something that we do a whole lot of here. Transitional care is really big here on our Gear campus, both between the assisted living facility, independent living, even the Beckley House, even our staff, or when somebody goes from regular care even to hospice care. That's another transition. Lots of changes can happen in those times, and we're keeping tabs on. We're keeping on top of these things. Okay, I'm sorry for talking so long and so much, but I wanted to open this up to questions. Stacy, are there any online questions that we can take here or?
Sure. Thanks, Charlie. Let's give everybody a second to see if they do have questions. I appreciate all that information, even though you felt it was going long, it was very good information. I know as I think about my parents that are aging, and I'm fortunate that I have a sister, like you had a brother, who oversees a lot of it. But you're right, that communication and that transition when something happens is absolutely where things can easily fall apart, especially if families are not as knowledgeable as you are, or don't have the resources that some of us do. So that's why it's so great that you are able to do something like this and be available to people, because we're lucky we work in the environment and we have access, but not everybody does. So if there are any questions, put them in the Q&A section or the chat section and we can ask Charlie directly. But of course, as always, I know that Charlie would be available afterwards if you want to ask questions in private. And I'm going to try to remember Charlie's phone number, 860-824-3822.
Yes.
Okay, so that goes to the pharmacy. And then all of our email addresses are our first initial and our last name at gearcares.org. So Charlie would be CPAGE, Charlie Page at gearcares.org. That's GEERCARES. You can certainly feel free to reach out to him with any, private questions that sometimes people don't want to ask in a group. But so I don't see any questions coming out for you in public, Charlie, but that's
Okay.
great information. Thank you so, so much for sharing it. I know you could probably talk for another hour. You have so much knowledge in that head of yours.
Yeah, I'm sorry. I was getting a little crunch for time at the end and I started to talk kind of fast, and I do that sometimes. I'm sorry about that. But yeah, I am passionate, and with my students, I do the same thing. I really get going, and I got to stop myself at some point because there's just so much I want to tell people,
Actually, here is a great question. Can the pharmacy take back unused medications?
The short answer to that is no. We are not supposed to take back something that's already been in somebody's home. But what you can do, especially right here in the local community, is you can take that to the medication drop box at the Canaan Barracks at the state police station. It's almost like a mailbox. You can just throw it in there and it will be taken care of. We just legally are not supposed to take back anything that's left the pharmacy and has been in somebody's home.
I think it actually is this weekend, Saturday, the 23rd. I'm not sure exactly the time. All of the police barracks, Canaan, as well as I think it was Winsted and Torrington, are doing a specific medication take back day in conjunction with the prevention network in the area. But I know that the Canaan Barracks one is also there all the time. So that's a good thing to know.
Thank you.
Charlie, just as a subsequent to that, are there any safe ways to get rid of medications if that's not an option for you?
Well, the old idea of flushing things down the toilet is kind of outdated now, because there could be some chemical that you do not want to get into, like the sewer system and then into the general, waterways. So what they say is to just mix it with something unpleasant, like, use coffee grounds or kitty litter or something like that, and put it in some kind of a container, like maybe an old laundry detergent container, and then put that in the trash. That's the safest way of handling it if it's going to be on your own and not through a take back system like at the barracks.
Okay, and that's because the coffee or the smelly stuff inhibits animals or something getting
anybody inhibits anybody that thinks that they might want to get it. Animals, yes, but anybody who might have some kind of an interest in the medication for some reason, and you just want to keep them away from it.
Okay, yeah, I guess a dirty diaper would definitely do that.
Sure would.
Okay. All right. Well, we're going to end there. Again, if you have any questions, feel free to reach out to Charlie. Or if you can't reach him, I can always pass it along. Thanks so much, Charlie. Appreciate your time.
Okay, thank you again, everybody. Thank you,
All
Stacy.
right. Bye-bye.
Bye-bye.